Court records show that the shooter, born Robert Westman, had his name changed legally in 2019. Just a few months before his 18th birthday, documents were signed off by his mother, Mary Grace Weston. There are a lot of questions surrounding the shooter's psychological state and the role that political trans played in another violent outburst from another confused and troubled young person. Joining me now is Chief Patient Officer at the Wellness Company, Dr. Drew Pinsky. Dr. Drew, it's great to talk with you. Americans are very concerned to watch the infiltration of what I would classify as left-wing politics into every aspect of our lives, especially medicine. We watched as CDC, for politics' sake, tried to redefine gain-of-function research, and we saw a few years ago the trans diagnosis being taken off the list of mental disorders, apparently for the same reason, politics. What is your level of concern with this?
Oh, profound, profound. Any centralizing of authority in medicine is a bad outcome for patients. Look, ask yourself one question. I assume the evidence suggests that this young person interacted with the medical system and had medical care. Is this person better off because of that treatment? Think of any of the other trans-identifying perpetrators who committed murders. Are they better off because of their interaction with my peers? I am disgusted by it. I am ashamed of my profession. Humans are complicated, and particularly the brain is complex. It gets sick, and it requires highly specialized treatment, not a one-size-fits-all, this is going to make you feel better, and this is why you're having these symptoms. Clearly, this individual missed in terms of comprehensive assessment. It would not have been hard to figure out that there were some very, very serious neuropsychiatric problems here, and they could have been treated. They should have been treated. Evidently, they were treated in this manner. I don't know if that particular disorder existed or not, but the fact is the outcome is clear. Horrible outcome. And we have to, as physicians, determine the right treatment for the right patient. And that requires comprehensive assessment and a variety of treatment approaches, not one approach for a given set of symptoms.
And we are prevented from doing that because the other side continues to make, well, arguments like this. The mayor of Minneapolis, Jacob Frey, defending the trans community. Watch.
I have heard about a whole lot of hate that's being directed at our trans community. Anybody who is using this as an opportunity to villainize our trans community or any other community out there has lost their sense of common humanity.
Well, I would like to
put aside the mayor's.
Look, I would like to vilify mass murderers. Okay, can I do that? Can I do something? Can I profile something? Can I vilify psychopaths who have a negative outcome, who are violent? I can vilify negative, violent psychopaths. That's a factual thing. These are people that harm other people.
I'm right there with.
They're not better off.
Right there with
they
you,
didn't
Doc.
get treated. They're worse off.
Yes, let's put aside the mayor's lack of caring for the dead children. Let's focus on the data. According to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, gender dysphoria prevalence accounts for 0.005 to 0.014% of the population for males and 0.002 to 0.003% for females. That is nowhere near the number that political trans says is out there. Doesn't the medical community need to take a stronger stand in defining what the data and the science says rather than the rantings of some left-wing lunatic mayor?
Yes, we have to. Look, I have patients with gender dysphoria who've been carefully assessed and carefully treated with the right interventions at the right age, and they're wonderful. They were treated properly. They are happy. They're living rich, productive lives. And those patients themselves would tell you, I have a serious condition. I have to take dangerous medicines my whole life, but I had this condition. This has really worked for me. I can't change that I have this condition, but this particular treatment, these medication, these hormones are working for me. It's very clear when you get a good outcome. And selecting that patient is something that has been completely overlooked. We don't know how to select the patients for the right treatment at the right time. So we're just saying whatever the patient wishes at whatever age is what happens. I don't know any other thing in medicine where that's the case. I just don't know. And in California, we're about to create a law where you can get a sort of an advocate to pull you away from your parents and get anything you want.
You know, folks, I thank God for my wonderful wife, my kids, my country, the greatest nation ever. And Americans like you who believe in the truth, the Chris Salcedo Show will never stop fighting for you.
The Chris Salcedo Show, for the news you need to know.